Hi, this is Dr. Karen Perez with a video on Impetigo. So, what is Impetigo? This is a contagious skin infection that usually consists of discrete purulent lesions. So, this can be caused by the Streptococcus bacteria or by the Staphylococcus. So what's becoming more common or seen in the impetigo is actually MRSA. So let's take a look at what the Streptococcus bacteria look like, round and they're attached together. This is actually a gram-positive bacteria, and for the Staphylococcus bacteria, they're round, and again, this is gram-positive. So what are some of the risk factors? So the most common risk factors are among children in tropical or subtropical regions. They occur during the summer month. The incident rate are high among children between ages 2 and 5, although older children and adults can also be affected. So they'll find that impetigo is actually more frequently seen on the face and on the extremities. So the lesion remained well localized, but are frequently multiplied and can be either a bullous or a non-bullous. So let's take a look at these types of impetigo. So for the bullous impetigo, this is caused by the strand of Staphylococcus areas that produce a toxin which affects the superficial layer of the skin. This is normally present in the nose before it breaks out in the subcutaneous disease. So it appears initially as a superficial vesicle that rapidly enlarges to form a bulla or a blister that is filled with dark or purulent liquid and can take on like a pustular appearance. The lesions rupture very quickly. And keep in mind that sometimes they rupture so quickly that even the patient nor their parent can identify that it was a lesion first. So this kind is more common in children. So for the non-bullous, it's more common in older children. So the lesions of the non-bullous impetigo usually begins as papules that rapidly evolve into vesicles surrounding by the area of redness. The pustula increases in size, breaking down in the next 4 to 6 days, forming like a thick like, and what you'll see described as a honey-looking crust. So as it relates to ulceration, the worst type, even though it is rare, it's a deep ulcerated lesions or sore that is noted, that is called eczema. This is one of the worst form that can occur with someone who's having impetigo. So the treatments are divided into treatments with few lesions and treatment with more or numerous lesions. So for treatment with fewer lesions, they will use Bactroban. This has a higher cure rate. They will even use Altabax ointment or Alvate, which is more expensive. As it relates to neomycin, and this is less expensive, less effective, but it is not recommended for treatment because it is not effective as Bactroban. All right. So again, neomycin is less effective and it's not recommended for treatment. So let's look at treatments with numerous lesions. So penicillin was a common choice that was clinically effective. One of the reasons why it was because Streptococcus was one of the most common bacteria found with individuals with impetigo. So because Staphylococcus currently account for most of the case of bullous impetigo, And for a substantial portion of the non-bullous infection, antimicrobial with gram-positive spectrum of activity and stability in the presence of the beta-lactamase, such as what we call the cephalosporin. And they are often used as our first-line drug, particularly as it relates to MRSA. Another medication that works on the Staphylococcus areas is the dicloxacillin. In addition, remember that doxycycline and tetracycline should not be used in children younger than 11 years old due to the risk of staining of their permanent teeth. So they may use also T-sulfamethoxazole and clindamycin. So if there's any kind of resistance to the macrolides, they may use azithromycin, clarithromycin, or erythromycin if there's any kind of resistance. Now, as it relates to the education, children with impetigo should be kept out of school or daycare for 24 hours after the initiation of the antibiotic therapy, and family members should also be checked for lesions, because as we mentioned at the beginning of the video, that this type of disease, skin disease, is contagious. Thank you so much for watching. If you have any questions, please do not hesitate to make your comments in the box. Thank you so much for watching. Here are my references. Thank you.